Welcome to Working Dogs and Whiskey. I'm Sean White. I'm here with my co-host Jonathan Moses, where we have open and honest conversations as we dive into the world of dog training. Dogs and Whiskey. I'm Sean White, and I'm sitting here with my co-host Jonathan Moses. What's up, dude?
Nothing much, man. That's a little bit of a struggle to get everything up and running this morning, but we're here now.
Yeah, no, I'm glad you made it. When you told me that you were thinking about doing this just me by myself, I was like, we're in a world of trouble, dude.
It all worked out, but I thought you were going to have to fly solo for a second.
Yeah, well, when that bridge comes, we'll cross it, but thank God it's not today. So we're sitting here virtually. We're all in different states, and we have our third guest, which I'm happy. It's been a long time coming, but we have Miss Rosa Witt-Consuegra.
Yay!
Yeah. Okay, go ahead and say it correctly so I feel better.
Rosa Witt-Consuegra.
All right, Rosa.
Yeah, just Rosa. It's fine.
Yeah. All right. Now that we got that out the way, thank you first for even wanting to do this and entertaining this idea.
Thank you for having me.
Of course. No, it's a pleasure. So we'll go right into it. If you could please just give us your background, like what got you into dogs, animals, and things like that. We'll kind of go from there.
Well, let me start by saying, I think you'll know by my accent, I was born in Colombia, and my dad is a veterinarian. So starting from there, you can imagine how many animals I had growing up. We had a farm and everything, and I've been, like, my first encounter with dogs and cats was puppies and kittens from the street. Like in my first cat that I rescued, I was 4 years old. And, like bottle feeding, actually like syringe feeding, because there was no Petco over there back then. So there was no pet stores. There wasn't back then. So syringe feeding little kittens and puppies and stuff. And there's a lot of strays there. So I had a lot of hands-on experience with that. And it just growing up, surrounded by animals. And my dad always instilled the love, especially more so from the medical aspect with the creatures that I rescue, birds, you name it, I bottle fed it or hand fed it. Orphan goats, all of the things, and either find homes for them or take them to the farm, and they kind of like live out their lives as kind of like wild animals in the farm, but at least they had solid food and shelter there. My first experience as far as like training a dog, well, I discovered it was fun. My first dog that was like mine that I got to keep, that we didn't get to send to the farm, was a poodle. And boy, was she hyper. And now that I know what I know, I can see all the things that were wrong with that poor thing. But she was very smart, and she caught on with a lot of tricks, and she was really like food driven and toy driven. So she knew how to do a bunch of stuff. So kind of that's what I found fun about it. But it wasn't behavioral stuff. I was a child, so it was just like teaching her how to do fun things and like wave and stand on the back legs and spin and little things like that. I'm like, oh, this is kind of cool, right? But then I moved here. I went to college there. I have a bachelor's in microbiology in Colombia. And then when I moved here, I tried to match my degree here, and it was a little impossible because the microbiology in Colombia, it's a little bit different than what it is here. Over there, I'm more like a nurse, and I get to draw blood and interact with the patients and things like that. And here I'm like, what do you mean you need a license to draw blood? Like, I would have to go to school to be a phlebotomist? I already do all this. So I decided to pursue something that was more fulfilling for me, which was working with animals. So I started, I went to school here I got my degree and license to be a registered veterinary technician. And I've been doing that since I moved here. So I've been here for 16 years now. And I've been doing that since I got my work permit, basically. Yeah. And in the last few years, right before COVID started, I got this dog from the school that I was teaching at, because I'm an instructor also at the veterinary technician program now. Like, that's one of my passions, is teaching. And then I got this dog from the school that came from Mexico. she looked like this little princess, Disney princess kind of dog. And I'm like, oh, I'm gonna take her home, and it'll be great. So over the Thanksgiving break, I know we're gonna foster her, and we kind of fell in love with her. And I'm like, let's keep her, and sign the adoption contract. What it's like to have another dog, right? With her, it would have been 4. And right, I feel like she knew when I signed that contract. She's like, I'm in. I can let my inner beast out. And this is kind of like the spark of my training career. I'm sitting down on the couch. My daughter, I don't know how old she was at the time, we were like 5, sitting next to me. And the dog was sitting on the couch next to me. She's kind of watching me, and my kid is right here, and I'm reading a book. And my daughter turned to me to tell me something, and the dog lunged from where she was sitting. Bam, and nailed my kid in the face. And I'm like I had my book in my hand, and I just my instinct was to single learning event, act of God.
There you go, good save.
I whacked her with the book I had, and it was such a meaningful learning event that she's my daughter's best friend now. But I was like, oh my God, I've never had a dog with aggression. When people say it came out of nowhere, if you're not looking, you do think it came out of nowhere because she was just sitting there. But now, knowing what I know, she was guarding me. She was sitting, looking at me, like possessing my space, right? And then when my kid came to talk, she just like a rocket went in her and just bam, and got her in the face. And I'm like, well, now I have my hands full. Like, I already signed this paper. I can't send this dog to somebody's home to bite somebody else. Like, what the hell? What do I do? So went down the rabbit hole. I tried to train her the way I knew because I had pretty decent dogs, but it wasn't something as far as behavioral modification, right? And I started going at it, and you always start with the all positive stuff and teaching her how, but then I reached my limit, right? Like, this is how far she's gonna go with cookies. And very stubborn, right? She came from a junkyard, and kind of like, she was nice, but she was also kind of feral, right? So, teaching her to accept my leadership was like the main thing. But then I knew this lady at my gym. I do jujitsu, and she went to my gym. Her wife is an MMA fighter. I went and I asked her. I'm like, hi, I knew who she was, but I never talked to her. And she's like, no, another person asking me for dog training advice, and I'm like, please, I need your help. And she's like, I'm not taking it. She was kind of a little bit and I'm like, just give me a chance. I'll come and I'll clean your kennels. Whatever I need to do, I need you to help me with this dog. And she's like, well, fine. This is all during COVID now, so everybody's sketchy with everybody. And she said, well, you can come over to my house and see what we have. And I literally, from that day, I became her apprentice, and she became my mentor for dog training. Her name is Brelyn, and she is amazing. And she kind of took me under her wing for the following 2 years. With her, I learned horse training. I learned how to do so many cool things. And most of the things she did was behavioral modification with aggressive dogs and stuff. So I got my fair share of that. Yeah, but she helped me turn my dog around. My dog is basically a service dog at this point. She is amazing. She's super smart. I started doing agility with her, and I can take her everywhere. She still has her quirks. I love her, and we got to keep her. Nobody got bitten again. Just one bit.
Yeah. And
then here we are. I got my little border collie here, and she's pretty cool. Give me a second. She's actually chewing on something here. Let's edit that.
Yeah, no, it's fine.
Pretty cool. She's sitting there like an angel. But it's that's kind of how it all began.
Yeah.
No, that's awesome. So I do want to, for the listeners, we'll go back to the single learning event just because I know, for people listening, I'm like, oh my God, she whacked her with a book. And it's yeah, no, I appreciate the honesty. I get it, especially as a parent. I think we're all parents here. So, but what I want to discuss in that is a single learning event and like what that meant. I mean, I'm sure in the moment you weren't looking at it that way. You're trying to
Yeah.
protect your child, of course, right? Very instinctive. But I know how this goes and with social media in these days. So if you could just cover like how you understood like that was a single learning event for the dog.
Well, the first thing that came to my mind is I gotta stop it, right? Like, given obviously back then I didn't know the meaning of all these things. I didn't even have a name. Like, I literally whacked my dog on the head with a book.
Mm-hmm.
That's all I could do to stop what was happening, right? But now, knowing what I know now, the fact that the event has never ever repeated, like, I can do anything I want to the dog and she won't even look at me wrong. That was a single learning event.
Yeah.
Right.
Yeah, like it left a lasting effect and the behavior never repeated again.
Good. Yeah.
Sometimes it might not be just one single event. You might need 2 or 3 of those single events to leave a lasting impact, but it happened, it worked. She understood what that meant. And I feel like the good thing about it was her being kind of feral. They understand consequences. Like a dog
That's
that
where I'm
lives on
going
the
with it. Yeah.
street, if they walk by one house and that person in that house threw a rock at them, they won't walk through that house again, ever
Right.
again. I understand that from growing in Colombia with all the like street dogs and all these things. Like they're highly intelligent animals, and nature works by having consequences. That's just how it is. She bit
For
my
sure.
kid. That was a pretty important consequence. I do not think she was expecting that because, she was like, oh, I'm in this house. I'm on the couch. My dream come true, or who knows, what was going through her head. But she was definitely used to, in an environment of scarcity, to resource guard certain things.
Right.
Yeah. And she still does it to a level with things that belong to me. Like if I put my backpack on the floor, you will find her kind of just like casually laying near the purse or the backpack or something, just like acting like, but you can tell, like that's normally not the spot where she lays. You can tell she's kind of doing something, but then you walk right by it and then I pick it up and she just moves along. Like there's no conflict or anything. But you can tell still is something that's ingrained in her, guard things.
Okay.
Yeah.
Yeah. It's funny you talk about the difference on like how the street dogs pick up on the consequences so fast. Me and Sean just had a pretty interesting conversation the other day. I've got a Tibetan Mastiff, and he's more of like I say he's as primitive as a dog gets. Compared to my German Shepherd, my Mao, we were saying how we don't think they would make it because they've been so genetically altered to go through consequence. If they were left on their own devices, they would not survive. So it's pretty interesting to see that's actually happening, where the dogs pick up on that and just kind of passing through the genetics of those dogs.
Oh, yeah. Yeah, you can see it like nature, like I said, nature works through consequences. Like the horse touches the electrical fence, they won't come near it again. When you teach a dog the invisible fence line, you could take those flags and put them somewhere else. They'll still see the flag and be like, it's there, I'm good over here. Like the major consequences that leave lasting impacts, it's life-changing for them. And it's not something like she's not scared. That dog is not scared. It didn't leave a fearful consequence in her. It just taught her, this kid right here, you cannot touch her. Like, no. And out of the question. And she's never, ever even like raise a lip or give you side eye for anything like that. That kind of like open up a whole aspect. And I don't know, like if people like the pack hierarchy and, whatever, but dogs do have some sort of like respect scale, if you want to talk about it like that. I don't hit her, I don't smack her. That was literally a single event for me too.
Yeah.
But we have an understanding. I can brush her teeth, I can trim her nails, and she surrenders to me. And this is a dog that was in a junkyard in Tijuana. So it's not like she had any kind of training. Like first time I put a leash on her was like putting a leash on a Mustang, a wild Mustang,
Oh gosh.
Freaking out, right? And I'm like, oh, she's so cute, I'll keep her. Here we are, right? Like,
yeah.
that concept of, oh, I can fix it, and yeah, you get humbled.
No, and I think you touched on something very important. Like John said, we had this conversation, almost the exact same conversation. And I think, especially what I see nowadays, like people don't entertain the theory of single learning events as like a training philosophy, so to speak. And like you said, in nature, it happens to them all the time. Like absent the human, presence, something
Mm-hmm.
like that would have occurred. Like you said, the pack mentality. Somebody within a group of dogs is going to establish, you know, the order of things.
Yeah.
Whether, it's they go toe to toe, a bite on the neck or whatever the case may be, like an actual fighter, just posturization, how they posture up and one submits, whatever. But there's still, consequence, like you said, that goes into that. And I think people, I'm not saying this is like the first method that, I'm going to employ when I'm training dogs, but
Yeah.
I will say in the military working dog community, the times I've used single event learning was more than likely there had something to do with like a biting behavior that
Mm-hmm.
was just way too, like you can see it in the dog that the dog is very confident. Like you said, he's not expecting it. And we kind of now, analyze how that's going to look. And we say, hey, he's not going to expect this one significant correction. And I think it's enough to leave a imprint that on this context, you do not bite, which is a very
Yeah.
thin line for what I do because we're constantly training them to bite. So
Yeah.
it's
You
got
don't
to
want to
be very,
suppress that, right?
yeah. So it's got to be very, potent and specific. And like I said, there's a lot of background information that I take in and analysis I do before I'll employ something like that. And of course, I've tried other means or other people have tried other means. And so it's like, all right, we're reduced to this. And the hope is that they make the perfect generalization. Like you said, for you, it was the child, right? So she understood it. I don't bite your child. That's off limits, right? But she
Mhm.
didn't make the generalization that every time you open a book, it's W. So, and that's what we aim for, in training. But I'm glad you touched on it. I didn't, no, I don't want to stay on this because we have lots more that I want to cover. But I just wanted to touch on that because it's something that's actually important and I don't want it to get out of context of what
Yes,
happened. And people are like,
absolutely.
all right, Rose is just beating dogs with books, something crazy.
No.
But no, and that's a thing, and I'll leave it alone after this. The other part too is because I know, like for me, like I've had instances where I've done that, like something close to that, um, and it doesn't feel good for me as the
Mhm.
as the person administering that type of punishment, and I think that's the other part because I've seen some bad training. I've been around trainers that, for whatever reason, they think it just gives them some type of, I don't even know what it is. A good dog trainer, I think, genuinely cares about dogs. And when we
Yeah.
come to those moments, like I said, it takes me a while to get to that point. Like I've stayed up late at night trying to figure out, is this the best method? I've had conversations with John and other trainers, multiple trainers for different dogs, trying to figure out another way. And they're like, no, dude, that would be the answer for that specific issue. And it doesn't ever feel great, but results in like the longevity of the dog. I think in the interest of the dog, that's what that method is used for.
Yeah.
No.
Yeah, so I did want to point out something each of you guys said when you were talking about the single learning event. One, it didn't make the dog fearful of you,
Mhm.
or like you said, it's generalized to one specific thing, and I think that's something that's overlooked, as well as most of the times when we're talking about, like Rosa, in your situation where she went after your daughter. Sean, I know we've had several conversations about, hey, I think we're going to have to go this route with this specific dog. But generally, it's for the dog's life, essentially. Like that dog is at the
Right.
point where if this doesn't get fixed, this is a last resort. And if this doesn't go well, you might be put down or there's going to be serious consequences for somebody else. So I feel like that's always kind of for a good trainer, like you were saying, it's a last resort kind of thing. And those are kind of the criteria that has to be met before we use training to that extremity. So just wanted to point that out, and it was something I heard both of you say. So that was good. No, we're
It's
thinking
kind of
similar.
like the farm dogs that like to attack the livestock.
Yeah.
and stuff like that. Like that will be a great loss for the farmer and
Hmm.
potentially for the dog too, right? And then when you got, it's very reinforcing for the animals to do things like that.
Yeah.
Like, not to like expand this subject,
No,
but
yeah, that's what we're here for.
like in my dad's farm, right? If we
Hmm.
ever had a dog that wanted to attack the livestock, I mean, my dad was like super cool. You can bring them all here. That's okay. But if there was a dog that had a problem with the animals, something had to be done, right? So they would kind of like set it up and wait for the dog to do something, do a single learning event, right? So
Yeah.
it was that or they're gone. And by being gone, that means they're going to be in the street and get hit by a car. So it's
Right.
a a death sentence for the animal.
Yeah.
And this makes it a little easier to talk because I come from another culture and people
Yep.
here will be like horrified, but I do want people to know that's not what I do in my training. That was a people learning event for myself as well. And that's what motivated me to seek out help and in that turn kind of like expand my career with animals because I saw how fascinating it was to train dogs. I mean, like watching my mentor do all this training and watch these dogs that will come in that, you know, the owner was unable to take the dog out of the house for months because it pulled on the leash, it broke the owner's arm, it attacked the grandchildren, and then watch them live there, a whole different animal. That was life changing. I'm like, I want to do this too.
Oh yeah.
No,
Yeah.
that's
You got
awesome.
into it on a really interesting side of it too. Like, so from what it sounds like, you went straight into behavior modifications. Uh,
Yeah. Yeah.
that's pretty intense. That's
But you know what's cool too though? My mentor, she is very involved in working with veterans and producing
Hmm.
service dogs. So when I met her, she was just kind of building her program. So she had just gotten like a few females and she had her stud and stuff. So I also got to be part of breeding dogs, which is not everybody gets, at least not responsibly, get a
Yeah.
chance to properly, breed dogs and be introduced in that aspect. Me coming from the veterinary field, it's all spay and neuter kind of thing. So I was open to the concept, like watching her dogs be intact dogs. I mean, in Colombia, you see them all the time, but here, like, I have forgotten what an neuter lab looks like, right? Like
Yeah.
buff and beautiful. And I'm like, oh, this is kind of like what you actually see in the TV when they're showing the dogs versus all the little scrawny things that everybody has, right? And the obese dogs and all these things. And her dogs were just like so fit and so well trained and so beautiful.
yeah.
And then be part of like raising the puppies and the birth process and teaching all the puppies all these like cool skills. I mean, I got the best both worlds in one person. So I was very lucky to meet her. And not only that, I mean, like she rescues Mustangs from like the slaughterhouse and rehabilitates them and then adopts them out. So I got to like, when in my life did I ever think that I was gonna learn how to like tame a horse and like teach them all these cool things? And I was like, oh my God, I'm riding a horse here that I helped take, like really cool, very cool. So I was very lucky and fortunate to find a person to enroute me in what I'm doing today.
Yeah. No, that's awesome. Did have one more quick question for you, and I'll let Sean ask some here because you brought up a good point that I've always wondered about the whole like adoption versus rescue thing. I've run into so many people who have told me who are a little very diehard rescue, almost overkill, where they said we should spay and neuter every dog. And I had to explain to a lady that meant within a few years we'd have no dogs. And then even my wife just asked me yesterday what I thought about adopting, just because all of my dogs are high drive working dogs. She's like, what if we go find a couch potato that we can rescue from the shelter? We've been talking about doing more work with shelter dogs. I want to know your thoughts on when you're selecting a dog for your family or for anything really, the benefits and pitfalls of rescuing versus breeding, and when you kind of lean which direction, since you've had a pretty good look at both sides.
Well, I feel like it is very cool the concept of adopt don't shop kind of thing, right?
Yeah.
It's a noble cause, but if you think about it, why are those dogs in the shelter? It's because irresponsible breeding. A responsible breeder will, first of all, health test their dogs. So most likely, that doesn't mean always, because even with the health testing, you can still have mutations and things happen that can produce sickly dogs, right? But
Right.
the chances of getting good quality, healthy, stable, and their temperament kind of dog is through a reputable breeder. And most breeders will have that thing in their contract that says if anything happens with this dog, you can't keep it, you're moving, you're dying, whatever, bring the dog back to us. We'll take it even if the dog is 16 years old, right? That's the compromise that this person is doing by breeding this dog. And then you have the accidental litter, the irresponsible person that grabbed
Right.
this dog and took it from the neighbor and now they don't want it. And then they do all this, harvest all these undesirable behaviors, and now they can't keep the dog and the dog is not safe, or the dog is like a horrible dog to keep. So they dump it in the shelter, right?
Oh.
That doesn't mean that in the shelter you won't find amazing animals. I mean, I've had, when I moved here, I wanted a purebred dog. Like back home, it was, whatever mutt was walking the street, I'll pick it up, take it. Not here, right? So I'm
Yeah.
like, I want a little smooshy face, like the cutest little thing, because back then we didn't have a lot of those. So I found a really good breeder and that I got my Boston Terrier from. She's long gone now, but she was like the best dog I've ever had. And when I spoke with the lady, she said, my Boston Terriers look a little bit different, she told me. And I'm like, what do you mean? Like, I don't want, I want the, like, I want the full deal. And
Yeah.
she's like, mine have a smaller head and longer snout. And I'm like, why is that? I mean, this is me being ignorant of this, right? And she said, well, I'm trying to improve my lines so my dogs are able to give birth without having to have C-sections. My dogs don't snore. My dogs don't have what's called the brachiocephalic syndrome, which is pinched nostrils, long soft palate, problems with the spine kind of thing. And I got this beautiful thing. Like, I never heard that dog snore. A Boston Terrier that doesn't snore, right? And it was
Right.
wonderful.
Yeah.
When the dog was born, she had one blue eye. And she called me when the puppies opened the eyes. And she's like, this is the first time like some recessive gene popped up in her line. This is the first time I have a dog with a blue eye. So you cannot breed this dog. I don't want this to be passed on. She even gave me a discount. Like, it's okay. I just want a pet. And she was perfect, right? So that's a reputable breeder. And then you have everybody else, right? People that are breeding purebred dogs, the amount of dogs they're producing every year also contributes to the overcrowding of the shelters. So by all means, if you want to rescue a dog, go for it, but you need to be conscious that the health might not be the best. And whatever experiences that dog had in the past, you're going to have to deal with that baggage, right? There are wonderful dogs out there in the shelter. I got a greyhound from off the racetrack. My God, best dog in the world. I have another little mutt from Mexico. He's still around 14 years old, still walking, but it's great too, right? So there's a lot of opportunity in the shelter, but I feel like you have to be open and honest and willing to know that, yes, I can take this dog looks cool and whatever, but regardless of where you get your dog, you're going to have to put in the work to bring the best out of that dog. So that would be my take, right? Like, I have owners call me and they're like, we want to get this puppy and it's this purebred, hunting breed kind of dog, but it's our first dog. And I'm like, hold up. That's at the point where I'd be like, what are your expectations? Oh, I want this little couch potato. I'm like, well, but that like hunting dog is not going to be a couch potato.
Yeah.
And I even offered, we can go to the shelter if you want to. I can help you look. Let's go, through the process. Some people take it, some people don't. So it's kind of a matter of choice and whatever they're convinced. And whenever you have purebred dogs, you will have people looking at you and like, you bought her from a breeder. Adopt. Like, don't judge, right? If I got her from a breeder and I was like breeding her and mistreating her and all that kind of stuff, then judge me, right? But if I'm doing good for my dog and being a responsible dog owner, why judge?
Yeah.
Right. And
That was a great answer.
yeah, I really like it. And I think all of it goes back into intent. Like, what is your intention? So, like, I know people that buy, purebred dogs, but they also know what they're buying into. And they know that, like you said, these are the specific characteristics I'm aiming for that associates with the breed. And that's what they want. And so, to me, it's kind of, I try to think of opposition a lot these days. So, what does the opposite look like? If that same person that wants these specified genetics and that's what they're trying to achieve, if that's not on the list of options for them and they go in to an adoption shelter and they run the risk of running the lottery, you don't know what you're going to get, right? Even with the quote unquote purebred dog that's just swooped up into a shelter, you still have to consider the experience that it may have had, and you don't know what you get for, like, your dog, for example. I know we keep going back to face biting, but that's something we don't. It's a classic example. Like, the dog was fine up until certain conditions and criteria were met, and it's like, oh shit, she's a resource guarder.
Yeah.
So, and that's kind of the risk that you run. So a lot of people that I know, friends that aren't even dog trainers or anything like that, just the average pet owner, and they buy breedings specifically to avoid that, right? Because they know that they're not willing to manage any of that. So it's kind of responsible, in and of itself. But yeah, I think the biggest thing is, like, my ex-wife and I, we adopted a dog probably, I think about 6 years ago. And she's still alive, she's still doing good. But that was one of the things that we had to consider. Like, she was hell bent on adopting, and I'm like, all right, if we're going to adopt, there's risk involved. Like, I don't know this dog. Like, it can look as great as it wants at the shelter, and I have no idea. I've been around dogs. I can kind of gauge if they've trained it a little bit to look a certain way, but there's no guarantees in dog training in general. You have to accept risk involved with that. So I think that's the biggest thing, is understanding what your intents are and knowing what you're getting into, and not looking at this dog as just this cuddly little thing. Like, it's a living, breathing animal that can make its own decisions based off of its environment. So it's a lot there, and that's a good point.
Yeah, I love mutts. I work with mutts every day. I have multiple clients that I've trained their mutts, and they're amazing dogs, right? And when you kind of like unlock that moment where the dog actually like buys into the training and the owner starts looking at the changes and their faces changing, that's like a magical moment. And they're like, and then that reinforces their thing. Oh yeah, adopt, don't shop. But I'm like, but look at all the work you're having to do, right? This dog is amazing, but it needed all this work. And it's the same thing with a purebred. I mean, they can come from the champion parents, but if the one you got was not necessarily fine-tuned to the championship, or your training is not the same training that the owner of the parents did, and your timing is off and your rules are off, and whatever, you can derail what genetics gave you with your environment.
Yeah.
I got this dog right there. Look at, she's like a little angel. I don't know if you can see her. She's
Yeah.
back there.
There she is.
And I thought, my next dog, after all the mods, and I'm like, I know all these things. I'm going to get another good, reputable breeder, active breed, and I'm going to do agility, because I started doing agility with my mutt, the one that bit my kid. She does agility with me. So she opened the doors to me to learn a new thing, and I love it.
Awesome.
I'm like, I'm going to get my purebred high drive dog. And I got broken. And it's taken me like a solid year to get her to a point where because she's extremely sound sensitive. So everything freaks her out, and she's not good at generalizing. Like, if that noise scared her here, then she's going to be afraid of that, whatever event surrounded that noise forever. Right? They're too smart. Right? The border collies are too smart. Her breeder is great. I went to pick her up all the way to Wisconsin. I didn't want a dog from California. Nobody wanted to give me breathing rights, and I wanted to do what my mentor was doing. And I'm like, maybe I can breathe it. Like, you fantasizing that everything's gonna be great.
Right.
And
Yeah.
I found this breather. She told me, if the dog works out fine, I have no problem giving you breathing rights. I went all the way to pick up the dog, met the parents. We met at an AKC show. I saw her parents win ribbons in front of me for obedience and rally. They were going to compete in agility later that day, but I had to go. So I didn't get to see that. I'm like, this is going to be great. The puppy was just like amazing. And oh boy, I don't know if she came equipped with, it's like that combination, like the genes are there, but the epigenetics that are going to wake up those genes or bring out the worst of those genes, it's your responsibility too. So I'm like, I ruined her. Like it was a disaster. So through training her, I also met another trainer here in San Diego. His name is Gonzalo. And he's very like intuitive, and like it's a little bit different than what I was doing with the behavioral modification. And I was working mostly with like labs and goldens that are a little more resilient, right? So they will recover quickly, they want it to work, there's a different kind of dog. And you
Yeah.
got this bundle of nerves that you're like, oh god, if I look at her wrong, she's never gonna come to me, right?
Yeah.
So he helped me unlock that kind of like reading her behavior and doing all these things. And my gosh, she's doing amazing now. We're doing agility now. She's doing like really complex things in agility at this point. And I'm happy that I had to also go through that process with this dog, because all this is helping me grow. Like at first I'm like, oh, I gotta give her back to the breeder. I even like called the breeder. She's like, ship her back, I give you another one. I've never had that problem with one of my puppies. And I'm like, you know what? No,
Yeah.
I'm gonna work this out, because I always think if I can't fix it and I have the patience for it, and I send her to another home,
Right.
what is that gonna look for the dog? It's traumatic, right? To send her to another place. And I'm like, what's gonna happen? Who's gonna have the patience for this dog like I have right now? Like I raised her since she was little. Same with Heidi when she bit my kid. I'm like, I could technically give her back to the rescue, but why would I do that when she can also go and bite another child?
Yeah.
Right? That will be in my conscience too. So I work my butt off and fixed it, and I work my butt off with her and fix it. But you have to know, even if you buy from the best breeder,
Mm-hmm.
things won't always go like you hope they will.
Yeah.
That's my 2 cents on that.
It's funny you talk about you went from your one dog and you're like, oh, I learned so much with this one. The next one, I got this. It's going to be perfect. I just did something really similar. I had my German Shepherd that I was like, man, I learned so much. This next dog, I got this in the bag. Yeah, she is not my last dog.
Oh,
And she's
yeah.
got her own personality and her own set of problems that we're learning through. But it's funny because it seems like every dog kind of prepares you for that next step. But in the beginning, I feel like the wishful thinking kind of hits all of us. We're like, oh, I'm going to get this ideal dog. It's going to show me similar characteristics to what I had before or what I'm hoping for. And then they get home, they're like, no, watch this. So I'm glad it's not just me.
Like, you had a plan. I have another one. But
Yeah.
my agility coach always tells me, don't show me your first dog. Show me your second dog. Because the first dog is either that perfect dog that does everything, or the dog that gave you so much work that you're like ready to quit. And then you get that second dog, and then like if you had the easy one, now it shows you that you did not know. You don't know what you think you know. Or
Mm-hmm.
now you have a really good dog, but you went through hell with the first one. So you're much quicker to pick up and refine your skills, to went from this like moped to the Harley Davidson kind of thing. Yeah, that's kind of what I was expecting. Like I have a moped with my little, because she has like really bad hip dysplasia, Mexican mom. And so she's not fast, and I have to kind of like run with her. And then the first time I put Brokey, because I had started her here in my house, right? Like I would talk with the trainer to get her started when she was young and doing like super low obstacles and things like that. So I had started her here in the context of my driveway and all these things. But the first time I put her in the field and I sent her to go jump, I wanted to do the same thing, just like what I do with my other dog, just walk next to her. She left me biting the dust. Took off. And I'm like, what just happened? And the coach was like, yes, this is going to be great. And I'm like, but she's out of control. And she had sumis and she was just so happy. And he's like, no, this is a dog where we're going to work on distance. So all I've been working with her is staying in one spot and like remote control her and send her. And she's taken up to it so quickly. It's like beautiful to see, but it's a lot of work. It's a lot of work.
That's awesome.
So we talked, we're touching kind of on the training side, right? And I want to circle back because I can see it. Obviously, I can see it in your personality, like your physical movements, because we have the camera. But you can actually hear it. And I want to talk about more of the veterinarian stuff. I know John had a couple of concerns or questions with his dog and all that. But I definitely want to hear how that went. One, from, if you can just touch back the cultural difference from Colombia to America, like as far as the veterinarian training and all that. How did that, was that a huge shock or what was that?
Was it a shock? Okay. I hope you have like 3 hours for this. No,
of course.
It is an immense difference. Obviously, right now we're in 2024. Things are different, but me growing up, my dad is a large animal veterinarian. So all he did with smaller dogs was like the neighbor brought him the dog to do the vaccines or like a whole litter that people had. And we would do like ear cropping, tail docking. That stuff is still allowed there, right? And those were my interactions, right? Oh, the sick dog, my dad would prescribe it, but my dad didn't have a clinic because he worked with large animals. So his job was to travel to all the farms and do things. I just had this conversation with one of the doctors I work for. Even the large animal medicine there compared to here, when I first went to school here, we had a veterinarian that works with large animals come to give a lecture, large animal anesthesia and pain management. So he's talking about doing nerve blocks, like blocking local parts of the body to reduce the pain for the animal. For example, and I really hope you don't lose the audience for this, but
it's fine. We don't care.
So like let's say a cow, the fetus was not able to be born. Like it was coming breech or something, and now it's dead inside the cow. You got to get that animal out of there before it turns into an infection. Because if that whole cow dies, that's a giant loss for your farmer, right?
Right.
So they either go in manually and fix the position and pull the calf out, or if sometimes they come with deformity, so they're all kind of like mangled and they cannot come in position. So they have to do like it's called a jiggly wire. It's like a wire that saws things, so you can like grab it and you cut things. So you chop it all up inside and you pull it out piece by piece. But the cow here will have an epidural, like a woman giving birth. The cow will have an epidural and she's just standing there, not suffering, getting the baby out or the pieces out or whatever. Well, in Colombia, they don't do epidurals. And they do all this by force. I mean, as gentle as they can, but the cow is fully awake and fully aware of what's happening. And sometimes you have 2 and 3 guys, like the calf is like wrapped in the legs with a rope. And then you got people pull and pull.
Goodness.
I saw this as a child because I was like my dad's sidekick, and I would go everywhere with him. And he would take me there and he would turn around and he said, if you cry, you cannot come again. Because obviously I'd be like, so I couldn't cry. I just stood there and watched, and he would ask me, pass me this, pass me that, help with this, help with that. And then I would do such thing. So when I was sitting in that lecture, and the doctor is showing videos and showing things and talking about pain management and how to help them not suffer through that. I was just looking at that, and I was like quietly crying on my desk. Like, it was like PTSD, reliving all the things that I saw as a child that were normal.
Right.
There. And I'm looking at this, and then at the end of the class, he came to my desk. And he's like, "Are you okay?" And I'm like, "Yes, I'm fine." And he's like, "You've been crying the whole class. Like, what's going on?" And I told him what was happening. And he put his hand on his shoulder. He's like, "Oh, yeah, honey. We try not to do things like that here." And I'm like, "But you have no idea what I've seen." And he's like, "Well, I've seen it too, because still farmers will try to do these things on their own, right? And some drugs are controlled substances, so they don't all have access to them. So you're still like, he will get a phone call that after the guy tried to pull the calf, and now the cow is all like hysterical in pain, then he has to come and like fix what they did, right? But that's just like a little window of how things are different in different cultures, right?
Right.
The spay and neuter culture in Colombia is very limited. The surgeries are still very expensive to do, and performing this surgery on your dog might mean that, I don't know, you can't buy all your groceries this month, kind of thing, right? Because it's a lot of money. Not for everybody, obviously. There's always more well-off people, but for your average person that's going to have a bunch of dogs in their backyard, that's hard, right? It's a hard thing to have access to, and the medical care is different. I mean, things have improved greatly, but it still has a long ways to catch up, right? When I moved here, growing up, let's say, I had a total in my house, a total of 3 dogs, 4 dogs. And one of them died because there was no like advantage, frontline, none of that back then. And ticks are everywhere there. And somebody went to do like a tick, and they did the dilution wrong, and the dog got poisoned, right? So right there, you don't have the access to the same medications, right? And then the other 3 dogs passed away of something related for not being spayed. Like one got a pyometra, and the 2 other got memory tumors, and that spread and they died. And that doesn't mean they didn't get care. Like when the dog came with pyometra, we took her to the clinic, we tried everything we could, but it was too late.
Right.
And she passed from it, right? And the other 2 also, they had multiple surgeries to remove the tumors, but towards the end, it had already spread. Mammary cancer is pretty aggressive. So they both ended up dying from that. So then when I moved here and I got my Boston, I'm like, I'm going to get this dog spayed as soon as I can, because I don't want her to go through what my dogs went through. So when I took her to the vet to her first puppy appointment, I said, what is as soon as I can get her spayed? And the lady's like, well, we can do it at 4 months. And at 4 months, one day she was there and she gets spayed. But now, working with my mentor and all that, like my whole mind changed, and all the new research that's coming out about not spaying and neuter so young. I'm like, my next dog, I'm not gonna spay her. And here she is. And it's so interesting to see how much she has changed for the better with every heat cycle she's gotten. I'm like, this was the right choice for her, right? And I am able to keep her safe, that she's not gonna be having random babies. So I feel, knock on wood, that I am an adequate person to have a dog that's not spayed, that I'm not actively breeding.
So, quick question for you on that. You just brought up like the change in personality or mentality with each heat cycle. So, traditionally, I've always had male dogs. It's just how I grew up. Dad didn't want any female dogs because he was always worried about another dog coming into the yard. And then as I got older, just working dogs, everybody wants the big male. So with my female Mal now, that's actually something I was wondering, because she's coming up on that first heat cycle, and I've always heard that. But I was wondering, what are some changes you actually see, knowing what you know about training and then your background with the veterinary medicine? What do you see the differences are after those heat cycles.
So my dog to begin with is still shy, but she was very, very shy, very like skittish, and like everything will make her like spooky. Everything spooked her, right? And I feel like after she matured, right, and every heat cycle she got, that nervousness has gone down significantly. I feel that physically too, because she always used to be kind of like crouch kind of thing. Now she looks like stronger and muscular. Like my coworkers always say that she has a six pack on her back because she's like, oh, you can feel the muscles on her back, right? Just different than a spayed dog. They won't
Yeah.
have. It doesn't matter how much you exercise them. They will take a tremendous amount of exercise to show the same muscle than a dog that has intact hormones, right? I just feel like she has matured, like, and I don't know, like it has calmed her down. And I don't think it's with age thing, because she still has the same drive. She hasn't lost any of her drives, but the way she like handles things, it's different. She recovers faster whenever she gets spooked, right? Like she had for the longest time, like this dog will be like, if she was eating her food and something scared her while she was eating, then she didn't want to eat the food. And then I feel like in her mind, it was the food that caused it, and she would go like
Right.
days without eating, right? So things like that was that extreme with her. And, you know, right now she's like solid. Like sometimes she's eating, she hears something, she gets a little scared, and she continues to eat.
Got it.
So
Yeah.
I feel like that has helped her. And I haven't, it's not something that I have trained. Like, how do you train your dog to not follow their instincts of getting spooked? Like I'm not counter conditioning her while she's eating. I'm not banging pots and anything like
Yeah.
that. It was so extreme with her. Then I'm like, I cannot even think of a program that I could implement, because I needed her to eat her food, right? Like she was like skinny, and I just kind of let her be. And on her own, she has realized and grown. I don't know, like I feel like it's maturity, that she has matured somehow into being more stable and more friendly too, less sketchy.
Yeah.
So
That's
I
something
don't
I
know.
hear a lot. So it's good to hear there's some legitimacy to that, or at least hear it from another point of view, because I've always heard that from a lot of different trainers and dog owners of working dogs. So it's pretty cool. It's something I'm looking forward to seeing.
It's an anecdotal thing, right? Like I don't think there's something out there that are like scientists be like, okay, this dog has gotten his first heat, we're gonna see how he matures. But anecdotally, you can see how the dogs change. Like even when dogs have litters, the mom kind of like comes out the other side a different dog as well. So
Yeah.
I don't know, it changes the physiology. And I think it happens with humans too. Like
Yeah.
you're not the same before you get your period and after you get your period. Like you change, and there are things that you cannot, like, you're not consciously be like, ooh, now I got my period, I'm a different person. No, it just happens. And then
Right.
it's just a physiological thing. Talk about periods.
No. Yeah. We already had an episode talking about periods.
An example of, like, you
Yeah.
do change, and it's not something that you can control. It just happens to you.
No, for sure. So just from prior conversations with you and I personally through Instagram and all that. So you specialize in like dental hygienics, I believe, right?
Yeah, and dentistry.
So I'm going to ask a question because this has been going on for a while, especially in the sport community. And John, I'm going to steal some of your thunder.
No, go
but
ahead, man. I need to hear this.
all right. The great debate on should you allow your dog to bite during the teething phase, like as teeth are starting to fall out and stuff like that, for people that do obviously bite sport-oriented sports. Like, what is your take on that as far as from your perspective is
Okay.
allowing dogs to bite?
Let me tell you that I personally don't work with protection dogs. So I don't
Right.
have a large influx of be like, oh, this puppy bit this. So I cannot tell you from that. But I'm going to tell you from the average dog and the special things that people do with their puppies at home. They're probably
Right.
not training with a PVC pipe, but they're like swinging their dog with the tug, and the dog is chewing rocks or giving them like nyla bones and things like that are pretty hard. The This is gonna get a little technical here.
Okay,
The
let's do it.
enamel of the tooth is the outer layer of the teeth, right? That is the strongest substance in the body. It's stronger than bone, right? It's a mineralized substance, right? The enamel of the baby teeth is nowhere near as thick and as strong as the adult tooth. So I do see a lot, especially with the canines, that people play a little too aggressively with the dog, or the dog likes to chew on rocks or sticks, or all the things that I mentioned before, and the teeth break. They break easily. So then what you see in the crown, and I'm not sure if it's the same with humans, I think we have shorter roots, but what you see in the mouth of the dog, the crown of the tooth you see is just 1/3 of the whole length of the tooth. So if your
Okay.
tooth breaks at the base, you still have twice the length of that stuck up in there. And then the tooth inside has a cavity. It's called a pulp chamber. When the tooth is a baby tooth, the enamel is very thin, and the pulp cavity takes all the space inside. Like you can see it in an X-ray. If they show you 2 X-rays of an adult tooth, an adult dog's teeth and baby dog's teeth, you can tell right away, not only by the shape, but by the component inside the tooth. That pulp is wide when they're babies or young dogs, and it narrows all the way up into closest when they're seniors, right? So having a hollow tooth makes it more prone to breaking. So then let's say you're playing with your puppy, the puppy's starting to lose their teeth, they break. Now you have an open cavity into the jaw. And if that dog likes to eat poop, which most puppies do, or bites in the dirt or whatever, that bacteria goes up in there. And then you have like a straw introducing bacteria right next to the tooth that's forming up here. Okay. When the adult teeth are still under the jaw and they haven't erupted yet, and even after they erupt, but more so when they haven't erupted, they're also wide inside because the tooth is growing. So any sort of trauma or infection or something that happens to that teeth that are forming is going to mess up the adult teeth when they come out. So they can even get infected. They can get enamel defects. And now you have like a cavity in the adult tooth that's coming down and stuff like that. So I think it's very important that people don't overdo biting with their puppies. I think that the puppyhood is a stage where you could be focusing on so many other things with that dog and leave the biting when that dog is ready. If the adult teeth, let's say they start shedding their teeth when they're about 4 months old. And that's when they lose the first ones in the front. And then about like 6 months is the canines. Let's say you have a 7-month-old dog that looks like they have all their teeth. But remember, those teeth are still kind of hollow on the inside because they're growing. If that dog chomps on something really hard and it causes bleeding inside the tooth, then you have a condition called pulpitis. It's like a bruise inside the tooth. That tooth that's young has a lot of blood flow inside because it's still growing. And like I said, as the dog ages, it narrows, and then the blood flow kind of just reduces up to like maintenance. But while the tooth is growing, it needs all the nutrients and everything to keep the tooth growing up to its full potential, right? So then you have a tooth that looks kind of like pink or purple, and then now that can stain permanently the enamel. Pay attention.
Yeah, I'm taking notes. Yeah.
Pay attention. Look at your biting dogs that you get. Lift up, especially the canines are the ones that get that more often. You'll see some dogs have like gray teeth, purple teeth, pink teeth. They're discolored, right? And that's a tooth that's technically injured, right? So if you want to have a dog that has a long biting career, you want to make sure you take care of those teeth. So I think, and please, again, like I said, I don't train protection dogs. So maybe there is some crucial time that you do need them to bite before they get their full dentition. but I do think that you should wait. I mean, there's so many other tricks that those dogs have to learn, or their obedience part of their PSA or whatever component of whatever you're training for. There's other things that you could focus on, and socializing that dog and work on cooperative care. That's like, oh my God, number one thing that's a problem with bitey dogs, right?
Yeah.
Right.
We, at the work that I am right now, we get police dogs that come in. Then they have to, like, you have to have the canine handler with them because we can't handle them. And it's like, well,
Yeah.
to have work on cooperative care. And
Yeah. Before we get into that, because I know you mentioned like you don't do protection sports and all that, and bite work in general, too much of it anyway. And that's part of the reason why I wanted to ask you, because it gives just a little bit more of a sterile vices, you have a bias into it. So I'm glad, I'm grateful for just the honest feedback of the actual anatomy of the tooth. And as trainers, I think that's our responsibility to kind of gauge that with the information provided on what's best for the dog and, the intensity in which we conduct our bite work sessions. But no, I appreciate it.
I think that you could work like on a hold, right? Or sending the dog to get things or play with like rags and stuff. But I want to do like a pipe or whatever you guys use, or, even if you're doing the rag, if you pull the rag, you can snag that tooth and out that tooth goes, right?
Yeah.
I do a lot of dogs that they come like the eye is whippy. It's like a puppy, like, I don't know, 7, 8, 9-month puppy. They come with like a weepy, gunky eye, or like a little abrasion here or in the cheek. And you look at their teeth, and the teeth are all fine, like they already have the adult teeth. And then you take an X-ray, and you find the roots of a broken baby canine still up in there. Now the infection is up in there, and it busts through the eye or the cheek.
Shit. Sorry.
So,
okay.
And that happens to adult teeth, mostly over the carnassial tooth, the big premolar over here on the side.
Yeah.
Those roots are so long, they almost touch the base of the eye, like underneath the bone. So if that tooth gets infected, most likely ruptures through the eye. So you have a dog with pus in the eye. And then people treat the eye and they say eye drops and stuff, and then it gets better and it comes back. And it gets better and it comes back because the infection's still there, right? So
that's really interesting.
I have a case just to show you how important it is to take care of your puppy's teeth. This dog, his name was Hurricane, as an Australian Shepherd. The mom bit the puppy when the puppy was about like 18 weeks of age. She bit him on the face. I guess she's trying to wean them. The puppies are still bothering her.
Single learning event. Yeah.
Single learning event.
There we go.
Yeah. Got the puppy in the face right here. Crushed the face. Puppy was fine. They were worried about the eye. Puppy grew. Puppy came back later as a young adult. These teeth on the side where he got the bite were all the way erupted. You could see only the tips of the teeth. And he kept getting this abscess here in the face. So we put him under anesthesia and we took an x-ray. And the teeth, the 3 teeth here on the side where the dog sustained the bite, the teeth look like a popcorn inside. Like the roots of the teeth kind of look like that. They were all mangled and fused together because those teeth were still forming when the puppy got bitten. So it kind of like cracked the mold where the tooth was going to grow. And they fused like that, and the teeth grew in this mass of tangled, crushed teeth that were, and then the enamel of the teeth was all cracked too. So it wasn't intact, and it was allowing bacteria from the food and the daily life walk in there. And that was like a whole thing because you extract normal teeth, but a tooth that's all mangled, that's like a whole surgery, right? They had to like lift all the bone here. And kind of like imagine like oh my God, what do you call it? People that unearth the fossils? Archaeologists.
Archaeology, yeah.
And you're like unearthing all those mangled roots in order to extract like a whole piece or in pieces because it's not a normal tooth. So that dog now has a gap here that he's got no. But that happened when he was a baby. Right? So it's very important to take care of baby's teeth.
Something I wanted to ask you while we're on the subject. So, I believe my puppy's like 10 months old right now, and I've
Mm-hmm.
noticed a lot of like food buildup on her teeth, and I'm trying to be really cognizant of her teeth this time. 'Cause I noticed with my shepherd, like you said, the chewing on rocks, picking stuff up, just grinding teeth down over time, and doing a lot of bite work is going to do that anyway.
Mm-hmm.
So I want to try and preserve them as much as I can. What can we do as dog owners to brush our teeth? There's a good toothpaste. How often should we brush teeth? You hear a lot about not using weight-bearing bones from animals like femurs because those can be bad.
Mm-hmm.
So what are some good bones? What are some good toothpaste or good dental hygiene we can be doing with our own dogs?
Yeah, so brushing the teeth is going to be your best bet.
Okay.
If you brush your teeth in the morning and you're out of the home all day and you come back at night, your teeth are kind of gross already, right? Even though you're like drinking water and eating and chewing gum and whatever, your teeth already have that biofilm on top, right? You feel kind of gooey.
Hmm.
So it's the same with the dog. Imagine if your dog only gets the teeth brushed when they go to the groomer every 6 months. That's just like, it's going to build up. The bacteria start setting up on your teeth and it forms this like biofilm, which is that kind of like gooey jelly stuff. And
Yeah.
then plaque starts setting up, which is now the bacteria is like setting up shop and producing waste. And then the saliva, the minerals of the saliva accumulate over that. And now it starts solidifying. And then you have that calculus, which is like those, like, it looks like coral reef or something like that to
Yeah.
me. It's just like as it grows, it just keeps accumulating. It happens a lot on the canine and over the premolar over here because that's where the salivary ducts are. So the saliva gets poured over and
Hmm.
over throughout the day. So it's releasing all those minerals. And if the tooth is rough because it has plaque on it, the minerals start kind of engaging and snatching in there and it just starts building up. If you don't remove it, it's just going to stay there. I feel like the best option is brushing. That mechanical action of the toothbrush is what's going to get rid of that, right? But you have to start with a blank slate. So if your dog already has calculus, so the hardened stuff, you can brush it to prevent more calculus from building up. But the calculus is not going to go away unless you crack it,
Yeah,
right?
yeah.
And I
It just
don't recommend people cracking the calculus
no.
because you can crack the tooth or you leave the surface of the tooth rough. And roughness allows more calculus to build up faster and faster. So that's why the dog needs like a full-on like anesthesia, dental cleaning.
Yeah.
Then the tooth gets polished. And now the tooth is nice and smooth to prevent the bacteria to have something to cling on to. So brushing is the best. There's a toothpaste called CET toothpaste. It's an enzymatic toothpaste. That's the one that all vets recommend. That's the one that I use with my dogs. I know there's a ton of other products there, but this is the one that I have experience with and then that I recommend. They have multitude of flavors like seafood and beef and poultry.
Oh, it's pretty slick.
They do have a minty one, but the consensus says that the dogs and the cats hate the minty ones. So stick with the nasty ones. The fish, the beef. My dogs love the fish and the beef one. I don't give them the chicken one because my other dog has like a chicken allergy, so I just buy one for everybody. My
Got it.
dog that's 14 years old, I try to, and I'm not gonna lie, recently I haven't been that because I have so much stuff going on in my house. But still, in the 14 years of age, he's only had one anesthetic dental, and he still has all of his teeth except these two right here that I had to pull because, he's old. But for a dog that's 14 years old and he still has all his teeth and they still look good, that's pretty impressive. So I'm going to give myself a pat on that because, my Boston Terrier, she died at almost 13 and she had 2 dental cleanings throughout her life. So by brushing, you're able to avoid having to put your dog under anesthesia. And the reason why I had to put her on anesthesia is because she did like to bite on harder things. And she bit something with her last 2 teeth. I don't know what it was, but she came kind of like, kind of crying. And I could see her like when she would eat and drop the food, like there was some pain.
Mm-hmm.
And then we put her on anesthesia and then she had broken the roots of the two last teeth. So I think she must have like chomped on something and cracked the teeth.
Hmm.
But that was the only extraction she had in almost 13 years of life. Where I had dogs that people bring that the dog is 5, and I pulled 20 teeth in one sitting.
Oh my
So
gosh.
it's impressive. And the dental health is not just like how your dog looks or like the ability to bite on the bite work. If you have all that bacteria sitting in the mouth, that bacteria, if you notice, like if you don't floss every day, that third day that you floss, you will have bleeding in your gums, right?
Right.
So that bleeding gum is literally open blood vessels, taking that bacteria back into your bloodstream. So these dogs live all their life with all this like nasty ass teeth, and then that bacteria is 24/7 entering their system. And then they come and they have a heart murmur because the bacteria sets up shop in the valves of your heart. So now the dog needs dental cleaning, but now the dog has heart disease. So then it cannot go under anesthesia. But
Oh shit.
you needed to put on anesthesia because you need to get rid of their teeth. And it's just like a catch-22 right there, right? And it affects their kidneys, and it's just like a poor life. Like imagine eating, every time you eat, your teeth hurt. And then you get clients that I'm like giving them like a quote, like your dog is probably gonna go home toothless. Like, I'm sorry, but it is what it is. Like, like a little Yorkie, a little Shih Tzu with like nasty teeth. But I don't think she's in pain. She still eats. We forget that they're animals. We have the ability to be like, oh, my tooth hurts. I'm gonna eat soup and I'm gonna have ice cream and nurse this, back to health, which is also a lie. You need to go to the dentist. But the dog is gonna keep eating. That's just it. Their instinct is like they will not eat unless it's something really bad. Like I have seen dogs that have a broken jaw and they're still eating. It's their instinct, right?
Yeah.
And that's another thing. Bad teeth can break their jaw, just saying. But going back to the home care, brushing the teeth, if you can do it daily, but if you can do it twice a week, you're already ahead of the game, right?
Okay.
And start when they're young and keep those teeth nice and smooth. There is a genetic component on how clean your dog's teeth, like how they accumulate tartar. I do think there's a genetic component to that. My dog Heidi, the junkyard dog, has the whitest, most perfect teeth ever. My border collie accumulates a lot of tartar over that tooth, so I have to be on it, brushing it.
Right.
She has really pretty teeth, but I can tell, like let's say next year she's gonna need an anesthetic dental cleaning because the calculus is already building on the edge, and no matter how much I brush it, it's not coming off anymore. So I'm trying to do as much as I can to keep it from building more, but it's already there.
Yeah.
Heidi, now her teeth are like spotless. That's just who she is. That's those junkyard genetics.
Yeah, I was going to say it's always the junkyard dogs that live to like some absurd age, like 23 or something, and then
my goodness, I think she will. Also, the mean ones live a long time too.
Oh, great.
But no, and you brought up a good point. Like, I see it a lot more in the working dog community, just because that's my area. But what you were talking about, like, people forget that they're dogs and the inability for them to express pain, versus their whatever reinforces them or whatever they deem is relevant to living, is eating and things like that. They don't. It takes a while people to understand that, like, hey, there might actually be something wrong with your dog. And a quick story on that, like, was my first working dog. She was very accident prone and had like no preservation skills. So ended up snapping her tail. I'm not as great with dog anatomy, but it was pretty much at the baseline where she had to have it cut off completely. It's the end result, right? But I remember, I pulled her and everything, and we didn't notice anything. Like, she did a detection scenario and all that, and she was working pretty fine. And so she just happened to back and the tip of her tail touch a wall, and she like yelped for a second, and then she just kept going, right? And at that point, by the time, and I was like, that's very different. I've never seen her express pain, and I was really, new to the dog community, so. But by the time we took her to the vet, it explained to us like, no, she has a very foreign to them, at that time, break in her tail.
Oh,
And
wow.
so, but getting back to what you were saying is that I think it's very important. Like I learned at her expense, a very valuable lesson of understanding, taking the time to assess your dog daily at a minimum.
Yeah.
I have been guilty of not monitoring the dental hygiene aspect, and I'm sure most people have been, because I mean, this alone was very educational. Like I didn't understand how the teeth can be the core, the catalyst for a lot of
Oh,
different
yeah.
issues. And
Yeah.
so I appreciate you bringing that up, but like you said, the inability
Mhm.
for them to express that, like, yes, my teeth hurt, but I also need to live, so I'm going to eat
Yeah.
regardless. But
Yeah.
that's a huge point. I appreciate it.
Yeah.
Oh,
Let me
that
tell you,
was.
like, when
Oh no.
they're when they're
Oh,
under anesthesia, right? Like they're supposed to, anesthesia is a level of unconsciousness where there's no pain or feeling perception. So they're out, right? And then you touch a painful tooth while you're cleaning it, and the heart rate and the blood pressure go up. And
Mm,
they're under anesthesia, right? And
yeah.
the nerves of the tooth are getting stimulated and triggering to the brain. Pain, pain. And then even even if they're still non-reactive, like they're still out, or sometimes it even wakes them up from the anesthesia. Like they start
Yes.
blinking, they
Yep.
start kind of like recovering some of the senses, and you have to adjust your anesthesia to bring them back down. But that shows you right there how painful that is, right?
Wow.
So I always advocate with people when I go do my evaluation for training the dogs. I always ask
Hmm.
about the health of the dog. What are we doing? I have sent them back to the vet. I make them go into a little bit of a weight loss program before we start.
Yeah.
And then if they have, and some people have been very thankful, and they're like, we didn't know. Sometimes I go to see one dog, but then the other dog over there in the corner, I'm like, kind of thing. And then
Yeah.
they're taking the other dog to the vet, and I'm like, oh my God, thank God you said something like that. So health has to be in check and in order for the mind to be able to learn all the stuff you're going to be teaching.
Yes.
I think it has to be harmony between the two. Otherwise, you're kind of like forcing your dog to work in pain.
yeah.
Yeah.
And us as humans, we're not that great at working with pain, right? We know how that feels.
Yeah.
So why would we subject the animals to do that, right?
Something else I did want to ask you because it's funny. Another friend of mine, me and him just had this conversation where he was working some police dogs, and he didn't really think much of it because you hear a lot of people, and there are some dogs out there that are just hard keepers.
Mhm.
They're just very fidgety. They burn a lot of calories, and I mean I'm guilty of it myself, having worked dogs who maybe aren't in the best physical condition, but mentally they say, "Hey, I want to work." They come out, they appear fine. Could you talk on that a little bit as far as some of the negative side effects of working a dog who, even though mentally they say I'm ready to go, but physically maybe they're not in the best.
Yeah, so I feel like the drives will override a lot of these things. Like, for example, like speaking of food drive alone, which is what a lot of like pet owners end up
Hmm.
working with the food drive of their dog. A lab will always eat, right? Like the day that your lab refuses the food, you better go to the ER, right?
Right.
But then you have other dogs that don't have a lot of food drive in there either because they're fed shitty food,
Hmm.
um, food that like they're like you enter the house and you're like, ooh, this dog is gassy. Like, what are we feeding this dog? You know, at least I know, God. Um, if you're gassy, if you're having indigestion, if you ate something that didn't make you feel good, you don't want to go to the gym that day to lift a single dumbbell, right? It's
Okay.
uncomfortable. You're improper in your position. You're mentally like, I'm hurting, right? So that's something that I really take a good look at. I ask what people feed. I make suggestions. Obviously, it's their dog. Dog is a property. You decide what you want to do with your dog, but I'm trying to give you what's best for it to the best of my knowledge. Dogs that are in pain, limping, older dogs that have arthritis, giant breeds that have a hard time like sitting down and getting up. Like, why would I make this dog do 10 repetitions of sit when it's having pain or it's uncomfortable. It might not be in pain, but they're showing signs of discomfort. So I do think that people should take a little bit more of a holistic approach on that. Be like, if you don't have the knowledge, like the medical knowledge to do that, you should at least require a physical exam within the last, I don't know, month or so before you take on a dog, especially if you're going to be doing, active things like you guys doing protection stuff. Your dogs are also doing, jumping and flying up in the air to bite the decoy and stuff like that. You got to
Yeah.
make sure that that dog is solid, right? The conformation of the dog. From afar, you can tell that these legs are like super straight versus a nice angulation of the legs. So the super straight leg, like pit bulls tend to have straight legs in the back.
Mhm.
That dog, when they jump and they do like a turning motion as they're jumping, like imagine when you're tossing the ball and the dog does like and they grab the ball up in the air, that twisting
Yeah.
motion, that's an ACL tear waiting to happen because the dog doesn't have the proper angulation on the knee. So
Mhm.
I see tons of, it's called TPLO, the ACL repair surgery for the bigger dogs. See tons of them. Majority of them are pit bulls because of the genetic component in that, right? So I think that we should be super cognizant, feel your dog out every day, right? Get used to, like, when you're palpating their back, like you're kind of like pushing along their spine. If the skin crawls in that same position, that's a sign of pain or discomfort of some sort. It might be enough that you can just like massage your dog out, right? And
Yeah.
condition the dog, or it could be something a little more significant. Like if your dog, the skin doesn't crawl, but then your dog goes
It
look back
twitches.
or
Yeah.
the back, that's pain right there, which is different than a little skin crawl.
Right.
So those are things that people should get used to. Like if you're putting your dog through so much and the dog is literally doing it for you, because there's no interest in the dog for them, right? Like they're doing
Yeah.
it for you and they're doing it to satisfy their drives. And those dogs that have like little self-preservation, they just jump right through things, right? So I think it's very, very important that people get educated in feeling out their dogs. And like what you said, like it was very abnormal that the tip of the tail touched the wall and you saw her whelp and then she still continued doing her job, right? So, but you noticed there was something off, right? So
Right.
getting used to those things and not throwing them under the carpet, right? Like think
Yeah.
about, this is very different. Why did my dog do this? So I feel like more people, like the more and more people are entering the working dog community, and not just the protection sports, but like in agility too. I see a lot of dogs and I'm like, when I go to the trials, I'm like, oh my God, like this dog has so much arthritis. Why is he still like, and that doesn't mean to retire your dog altogether, but it might be that you lower the category and now your dog doesn't jump 20 inches, but like 14, right? Because you don't want to also retire your dog and having them just put them in a closet, because
Yeah.
that's bad for their mental health too. But there are things that you can modify to
Yeah.
make it easier for them to do that kind of stuff. Yeah, the agility thing is like what I'm involved. I'm like, oh God, the limping, the little like that the owners don't see, but then the dog starts running and then the adrenaline,
Yeah.
and then the limping goes away and oh, they're fine, but then they come out kind of like, yeah. So I think it's very important to make sure the physical condition of the dog is good. It all starts with the nutrition too. If your dog is having mushy poop all the time, maybe something with the diet, or does your dog have parasites, right? Or does it have an enzymatic insufficiency for their digestion?
Mhm.
If your dog gassy all the time, that's not normal, right? So something to
So I'm
address.
glad you brought up the nutrition. So that actually brings up the last question I had written down for you. I wanted to ask you about raw food diets versus kibble and kind of the benefits of
Oh
that. 'Cause I
yeah.
know that's something that's gone back and forth a lot.
It's a controversial thing. I wish that I could feed my dogs raw food all the time. It's a little inconvenient, but I wish that that would be something that I had the time and the money for. So I try, and it's a big hole in your pocket. but I really try to feed my dogs what I think is the best according to my research, and also what my dogs do best on. Because the food might be, because expensive doesn't mean they're good. If you read the
Right.
ingredients and all the ingredients, the more vitamins the food has added in the list, that means that the food has been kind of like overcooked or whatever process they
Mhm.
did, and it lost the natural stuff in it. So then they have to add it. So a lot of people will be like, this food has a lot of vitamins, it's great. No, that means that the actual food lost all this nutritional value, and then you're just having to put it back in because you burn it out or whatever process they did to make the food, right? Supplementing with like raw food or fresh food, I think it's great. I think more people should get into that within reason, right? The problem I see with that is that a lot of people want to do like homemade diets without the proper balancing of nutrition, and then you have diets that are deficient, right? And then towards the end, it can kind of cost your pet's health. So you're trying to do a good thing, but if you're not doing it right, it's more it's not beneficial, right? For a company to put the food out in a shelf in a store, they have to meet the minimum requirements of the AFCO regulating company that measures. I can't think of what the nomenclature means, but they regulate the composition of the food, and it has to meet minimum requirements of food. So whatever you're finding out there, like from your Alpo to the
Yeah.
most expensive food, they have to meet that minimum requirement. What the extra length they go through that and how your dog takes it, that's a whole different deal, right? You could be feeding the most expensive, delicious, aromatic, freeze dried, whatever you want to call it. But if your dog is having diarrhea on it, might as well steer clear from that, right? So I appreciate the people that take their time to um, sort out their raw feeding. I'll give you
Right.
the example with my greyhound. He passed last year of bone cancer, but when we first got him, we got him off the blood bank. They use, in case you guys didn't know, they use greyhounds to donate blood to the dog blood bank, because greyhounds have more blood volume per mass of body than any other dog. Because of the athletic ability, they have to have more oxygenation to their body, and
Yeah.
red blood cells are what carry the oxygen, so they have more blood to give. And they also have big veins, and they're very docile, so they can sit there and get their blood sucked out to
What the
donate
hell?
to
I'm sorry. I'm
dogs.
just completely ignorant. I didn't even know there was a blood bank for dogs. So
Yes,
yeah.
absolutely.
All right.
Yeah.
The more you
Wow.
learn, the more you know you don't know.
The
Yeah.
one that I know of, it's called
Mhm.
Hemopet,
Yeah.
and they take the greyhounds off the racetrack and they keep them for a period of time, harvesting their blood every so often. And then
Mhm.
when they're done, they spay and neuter them and then put them out for adoption. So that's how we got Marshall. And Marshall was an amazing dog. When I went to pick him up, I asked, so what do you guys feed him? Because they're like, here's your dog. And I'm like, what does he eat? So I can go buy it. Chicken-based kibble.
Yeah.
And I'm like Purina?
Which one?
They get like the large generic whatever to feed these large dogs, right? So the guy's like, I don't know, it's chicken based. And I'm like, okay, cool. I'll take him home. I'll get him some chicken based and transition him and hope for the best. And I thought, yeah, he's probably going to have diarrhea for the first week while I transition him to whatever magical kibble he was eating there. And I started giving him the food, like being a vet technician, you get discounts to get like Purina and stuff. So I'm like, I'll get him some Purina chicken-based food that I would assume that that's what they're feeding them at a medical facility. So I got that. This dog, if he pooped and the wind was blowing, the poop will fly. And I kid you not, because I took him to the beach and I saw his poop. Like I had the bag in my hand, and I'm
Yeah.
like, I just put it away and looked like and walked away like shit, like literally, oh shit. The
Yeah.
poop flew away. And I'm like, oh my God, like what do I do? Right? So
Yeah.
did a fecal sample, he didn't have any parasites. I put him on a gastrointestinal medical diet, no improvement. I went to the extent of him having an ultrasound in the abdomen because this was like months and months, and he was like all bones and just pooping liquid every day.
Mm.
And I tried every single food. Like I had open bags of all the brands of food that you can imagine, all the medical grade dietary restriction kind of food as well, hypoallergenic, hydrolyzed protein, you name it, I tried it with that dog. And then one day I was at Sprouts. I don't know if you guys are familiar with Sprouts. It's
Yeah.
like organic supermarket. And I'm walking by and I passed through the dog aisle and there's like this Honest Kitchen freeze-dried food, and it was on sale. And I should try that. And I'm like, what is he gonna get? Diarrhea? Like I literally remember it to this day.
Yeah,
I'm
I was
like,
going to say you're already at the worst of it.
his shit flies with the wind. And I
Yeah.
grabbed the box and I took it. I'm just like laughing my way out of the supermarket. And I prepared it that night. I'm like, oh, this is like disgusting. It's like, oh, this like mashed potato thing.
Yeah.
Put it down. He looked at it. He devoured it. Because he was kind of like, his appetite was always, I'm assuming he was like cramping, right? So he didn't like to eat that much. He looked at the food, he engulfed that food. In the morning, he went out to poop, and I had a hose. Wherever he went to poop in the backyard, the hose will be, I was waiting with the hose because that's how
Yeah.
he pooped. And he pooped a turd. And I'm like, I called my husband. I'm like, Sean pooped a turd. He came to see it. And we were both looking at it like, we can't believe it. So I started feeding him that. So it went from like the overcooked kibble to the freeze-dried food, right? But he was 79 pounds. And that food is expensive. I did my best for like 6 months. I'm like, I'm broke. No more Starbucks. We're getting this dog on this food. I started feeding him that. He's gained weight. Like, he looked beautiful. His coat was shiny now because he was like rough and like dandruffy and just like, ugh. He looked amazing. And I'm like, okay, well, I can't continue doing this because it's a lot of money. Like, I really cannot afford this. So I started looking at the ingredients. And I'm like, well, what if I start half and half? Same ingredients from the box, and I'll transition him into me cooking. My husband bought me for the price of one large box of the thing, we bought a small freezer. And I had a small freezer and I was cooking his food. I went to the store and I'm like, I need how many pounds of this, and that. And the guy looked at me like, and I'm like, it's for my dog. I took all these like random pieces of different meat and vegetables and rice and all the same ingredients that were in the box. I started cooking it for him. And I transitioned him completely to the food that I cooked for him. And he was on that for like 2 years until I was just like, oh my God, I can't do this anymore. And then I started introducing kibble again. And I would literally give him like 3 kibbles in the meal, one at a time, until I was able to complete it. But it took him 2 years for his gut to heal. From all the years. I mean, when I got him, he was 4. From all the years that he went through with stomach problems, I would assume, right? 2 years it took me to transition him into just normal kibble, but he would eat only the gastrointestinal, like bland kind of kibble. And that's what he could tolerate. And every once in a while, his poop was kind of mushy, but it made it more manageable for me to be able to afford feeding a 79-pound dog, right? Because as a technician, we don't make money. So, and I'm like, well, I gotta try to find a way of keeping my dog healthy and happy with the means that I have, right? So I fully believe in the power of natural food. My dog showed me that. So if you can do it, go for it. But you have to do it right. If you're not going to do it right, like giving your dog shredded chicken and rice is not it. Because the chicken is lacking all the calcium and stuff that's in the bones.
Yeah.
If you're just only giving the meat, I mean, the dog might eat it. He might like it a lot, but it's not nutrition. It's not the density of the nutrients in there is not there. It's an incomplete diet. It's not balanced. So I'm all for raw, natural stuff, but you just got to make sure you know what you're doing.
It's funny you say that. I just got a box of Honest Kitchen in because I saw a client using it last week with the dog that I was training. So I've got some downstairs I ordered for my dog. because she has a similar issue. Like she could be really solid for a few days, and then I might get a week of really bad poops that are just loose
Mhm.
or aren't good. So the Honest Kitchen seemed like the most shelf stable
Yeah,
version of a raw food, where I don't have to have the freezer and everything. But I did notice it's pricey.
yeah, it's very pricey, but it was worth it because it helped my dog. I mean, my poor dog was like bones to the point where he was just like, he looked so unhealthy. I'm like, he's gotta have some sort of cancer or something. But he didn't have any of that. It was like the more diarrhea your dog has, is it like wears off the little hairs that live in the intestine. It just like
Mhm.
wipes off. Well, and those hairs are the ones that like absorb the nutrients. So if you're constantly having diarrhea and constant inflammation, they shrink and they slough off. And then your dog can't digest the food. So it doesn't matter what expensive food you buy, if the dog doesn't have the means to absorb it, it just all goes straight
Straight
through.
through. Yeah.
Mhm.
Yeah. No, no, I appreciate it. And we got to kind of wrap this up, unfortunately.
Yeah.
I know we all have lives to live, I know. But no, I appreciate you coming out and just coming on to the podcast, and this is actually way more educational than I anticipated. And I think I just texted John. I was like, we're gonna have to have her on again because we didn't even touch on cooperative care,
I know,
Lima.
I know. I
I
really
know.
want
Yeah,
to talk
it's a
about
big
that. So
disappointment.
we gotta have part two. And
Yes.
we got to talk about all that. And I have a message for all the people that want to work in the vet field too.
Okay. Yeah,
Okay.
we will probably.
We'll
Honestly, I'll
talk.
probably be nagging you pretty soon to do this.
Yes, let
And
me
we'll
know.
just put it out as part two. But I appreciate it. That and then the ending, I was just my mind drifts. I think we talked about it off air, how we all dog trainers probably have a form of ADHD to a degree. And I was just thinking, I was like, of course we end this talking about dog shit. Then I started thinking about the amount of buttholes that I've looked at.
Oh my God. Okay, I have one for you before you go.
Yes.
Take a look. This is, oh my God, please. I hope that if anybody that follows me sees these things, please know I'm a normal person.
It's
But
fine.
look at a dog's butthole, an
Mhm.
adult male neuter dog butthole, and
Mhm.
then look at a non-neuter older male dog butthole. Tell
Okay.
me the difference. I'm gonna give you that research.
That's
Now
our
I'm about to
homework.
go
That's
grab
the
one of my pet
homework.
dogs from downstairs. I'm
Was
going
that
straight to it. I got my older dog downstairs, and I got a pet dog downstairs who's
how
named
old is
Amelia.
he?
I'm about to
The
go
older
look.
one?
The
How?
older one's 5.
Nah, it's not too old yet. You
Not too
gotta
old?
wait for those hormones to like, when the testicles get kind of like old and like hardened.
Yeah.
Then I invite you to look at the butthole
Okay.
and tell me.
That's our homework.
I can't believe I'm into like this. You might need to edit this out.
No,
But
the people got to know.
it's a thing. It's a thing. Just look at it. Just grossly take a distance, lift the tail, and compare, and you'll see. You see
Okay.
All right.
what the testosterone does to the body in the
Mm.
anus.
Okay.
Okay.
All right.
Cool.
So for people that want to know more about teeth and buttholes and single event learning, how do they find you?
Well, I have my little Instagram. It's Educated Canine Training. It's the name of my little business.
Okay.
Same with the website, Educated Canine Training. I work in San Diego area, surrounding areas. I post a lot about my dogs. Oh, we didn't get to talk about the chickens. I post about the chickens too. I have
Yeah.
chickens. I'm still learning about the chickens, so don't bombard me with questions about chickens. But yeah, if you want to follow me and watch my journey with my dogs, I'm really bad at going back to the ADHD. I think that's it. I'm really bad at like recording the things that I do with my clients and stuff. So I feel like I'm lacking on posting more of the work I do with my
Yeah.
clients. So you'll see more of my dogs stuff. But yeah, that's kind of how you can find me. My Instagram is like the most active thing. I have a Facebook, but I don't even open it.
Oh. Okay. And for your for the educated canine, that's the whole word, right? Canine spelt out.
I think it has
Underscore, I
it has
believe.
underscores. Yeah, educated underscore canine,
There we go.
all spell out underscore training. and you will
Okay.
find me there.
Got it.
Perfect.
You'll see
All
me
right.
standing with a lab as my picture.
Okay, and we'll make sure to put it in the highlights under the and everything. We'll tag you in it, of course. But Rosa, thank you so much. This has actually been very, very fun, very educational, and we're gonna have to do it again for sure.
Thank you.
As
Thank
long
you
as
so
you're
much
willing.
for having me. It was really fun. I like it. Please don't think I'm weird. I'm just, this is just life as a vet technician.
Yeah.
Okay.
All right. Well, that'll do it for another episode of Working Dogs and Whiskey. Thanks.
Bye.
Bye.
Bye.